Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who is interested to attend. Today, we will be talking about COVID-19 reporting in Nhsn. Everyone will be on mute, but if you have any questions, please enter them into the chat and we will address them at the end of the webinar. And we encourage you to join us every Wednesday at 2 p.m. for more of the webinars in this series. Next week, we'll be talking about the Centers for Medicaid and Medicare's recent update on nurse aid training requirements. My name is Kathy Caudill, and I'm a communications specialist with Quality Insights. And now I'd like to introduce our guest today, Deborah Wright. Oh, goodness. Deborah, I lost your bio. I was gonna, I'll wing it. Deborah works with us at Quality Insights. She is a quality improvement specialist. Is that right, Deborah? Did I get that right?
Yes. Yep.
Yes.
Yep.
She's joined us pretty recently. She has been in the field of nursing for over 30 years and has done a lot of different positions in that, including you were a vice president of directing.
Yeah. So I started out as a nursing assistant and, worked my way up from there. So we've been in this business long enough. You've done just a little bit of everything. So we can skip the bio and just move on.
I'm so sorry. I thought I had it here in my little script and I must have deleted it or what. But anyway, thank you, Deborah. Welcome and thank you for joining us today. And ready to get off with our first question. So let's kick off with some background. What is Nhsn and what is their objective?
Okay, so Nhsn stands for National Healthcare Network Safety Network. In regards to the COVID-19 vaccination modules, Nhsn's protocols state that the weekly COVID-19 vaccination modules are designed to ensure that reporting of COVID-19 vaccination data is both consistent over time within a single healthcare facility and comparable across all facilities. It utilizes various standardized methodologies, including a web-based application for conducting vaccination surveillance activities. Using Nhsn to monitor COVID-19 vaccinations may also result in increased COVID-19 vaccination coverage because improvements in tracking and reporting those vaccination statuses will allow facilities to better identify and target unvaccinated residents and staff. By using Nhsn, vaccination coverage data can also be made available to authorities at the local and national levels to identify coverage gaps. The data can also be combined with data on infection rates to infection control policies and recommendations. And Kathy, I think you have a link that you're going to put in the chat that will take facilities right to the landing page for Nhsn so that you can look at different resources and YouTubes that they have and training modules that they have for all of the different areas that they service.
And that's right. And I've got the link in there, and we also upload these webinars to YouTube and our podcast. So if you're listening to this webinar later on in one of those formats, I will be including any links from today's talk into the episode description. And moving on to our next question, why is this data collection necessary, and what are the timeframes used for each reporting period?
That's a great question, Kathy. When COVID first started, as we can remember, at one point in time, we were reporting the same information to 2 and 3 different databases or agencies, and it was very trying back in the beginning to do that. Now Nhsn has become the preferred method for reporting to CDC and CMS, and it's used to collect data on the summary of COVID-19 vaccination counts for what we're talking about today. And facilities are currently required to enter their data at least weekly for the previous week, and their week is defined as Monday through Sunday. So then you have the next week to input your data for the previous week.
Gotcha. And who needs their vaccination status reported from the facility?
So seems to be a topic that frequently people have lots of questions about. So basically all healthcare personnel, both direct and indirect, that provide some sort of care to the residents at least once a week, and of course the residents themselves. So let's first look at the residents reporting, as that's the easiest. If a resident was in your facility during the previous week, even if for only one day, they need reported. So if you're a facility that has a lot of admissions and discharges, it's possible for your census during that reporting week to actually be higher than your census on any given day if you've had a number of admissions. Now, the healthcare personnel section, that's a little bit more challenging because there's 4 different types of healthcare personnel that they look at. First, you have the employees that are on your direct payroll. This area, it's pretty straightforward. If they're eligible, and eligible being the key word, to work in the facility at least one day, no matter how many hours, they get reported. And we have to remember that that also includes those that are on temporary leave. So if they're still your employee, even if they're on leave, they still need reported for that week. NHSN defines temporary leave as less than or equal to 2 weeks in duration, such as your sick time or vacation time. But once that temporary leave extends beyond 2 weeks, then that staff member would no longer be included for data collection purposes. Then you have the area of licensed independent practitioners. This would include your physicians, nurse practitioners, your physician assistants. And even if you take it a little bit further, a lot of facilities are also including your consulting podiatrist or dentist or other physicians that come into the facility. In this area, you need to include those that are affiliated with your facility, but not directly employed, regardless of the amount of time that is provided to the residents on a weekly basis. So what that means is with your direct healthcare personnel, if they're on your payroll and they haven't had more than 2 weeks off, they're going to be reported. But in the license section, you may not have a doctor that comes once every week. But if they're on your roster and somebody that would be providing services, they would still be in that section. Then there's the category of adult students, trainees, and volunteers. This would include students that you may have from an academic institution, such as nursing students or nursing assistants that maybe are doing their clinical rotation at your facility, or therapy students. And it also includes volunteers that are affiliated with your facility on a regular basis. So how I really look at that is if you just have a group coming in to maybe do a Christmas concert, they're not going to be included because they're one and done and they're out. But the volunteers, if you have volunteers that come into your facility on a regular basis, they would be included in that section. And then lastly, under the healthcare personnel category are all those contracted staff. So this includes that never-ending nursing agency staff. If your therapy staff are contracted and not on your payroll, it even would include your daily pharmacy delivery drivers. There's a whole list of individuals that could be included underneath this. And when you go into the NHSN landing page and you look at their protocols, there's a whole list of different individuals that could be included in that topic.
All right. And how do the facilities report this information in the NHSN?
So another great question. And for people that are new to reporting, there are 2 different ways that you can do this. First is just entering the information manually by going into NHSN and data inputting the information. Many facilities have developed their own spreadsheets to gather this information, and then you would just calculate it and put it in. And then there's the optional use of NHSN's developed event level COVID-19 vaccination forms. So these are really good, especially if your facility doesn't have someone that's good at creating formulas within their uniquely developed spreadsheets. The nice thing about the NHSN's event level forms is that it will auto calculate the necessary information and display the weekly totals for you. And I think Kathy's going to be putting a link into the chat for step-by-step guide for these event level COVID-19 vaccination forms. So I know that there was recently some trainings and webinars that NHSN has provided, but just from a high level basic review, when you're using the NHSN's event level COVID-19 vaccination forms, each resident and staff member would have at least one status entered, whether it's dose 1, doses 1 and 2, if they have a medical contraindication, if they've declined, or if you don't know their vaccination status. But there will be times, though, that a resident or staff member may have more than one entry on the spreadsheet. This happens maybe when their vaccination status changes. Maybe they originally declined the vaccine and later changed their mind, or maybe a resident is out of the facility greater than 2 weeks and later returns. So when this happens, you would create a new row for that resident when they return by using the plus sign next to the original row. This just helps to keep the spreadsheet more user-friendly for yourself, and so that you can track the resident or the staff member. So the original row would already have a discharge date entered, and now your new row would identify when, for example, the resident was readmitted. In these cases, when you use the NHSN spreadsheet, you're not able to delete lines. So that creates the possibility of having one person on the spreadsheet more than once. But as long as you have the end dates, when you add the new line, they will not be counted more than once for your reporting time frame. The event level COVID-19 vaccination form is located in the NHSN from the facility homepage. You can also, when you're in your reporting, it's on the left-hand side in the navigational toolbar. And when you enter the COVID-19 vaccination person level data into the form and select save, then that data will automatically be calculated on the reporting summary tab of the worksheet, where the reporting week will be collected prior to selecting the save and submit data button. And you'll know that it's successfully saved because the line in HSN will turn green, knowing that you have successfully saved that information. But however the facility decides to gather the information is truly up to the facility, and everyone will find the way that works best for them.
Okay. And now that we've talked about the vaccination reporting, let's move on to reporting of point of care test results, also known as rapid tests. Have there been any changes with the reporting requirements?
Yeah, so on April 4th, guidelines did go into effect that stated that entering negative test results is now optional. Only positive rapid test results need to be reported within NHSN and to the regulatory agencies. While in my opinion, there are certainly pros and cons to stop reporting negative results into NHSN. Just make sure that if you are going to stop reporting negative test results, that you also make sure to update your facility policies and procedures. And if you need to see where this guidance is, it was posted in the PAHON 635 that came out on April 12th. Kathy, I think you're muted.
I think you're right. And I just dropped in the link to oh goodness. There we go. I lost everybody for a minute there. I put the link to that you were just talking about in the chat for people to be able to see.
Okay, great.
All right, and I think we're ready to move on to the Q&A. If you have any questions, you can enter them into the chat or the Q&A box. And while we're waiting, I'd like to again remind everyone that our next webinar will be discussing CMS's recent update on nurse aid training requirements. That will be next Wednesday at 2 p.m. We also host office hours live chats twice a week. So if you are looking for one-on-one advice for your facility, you can pop in during our office hours and shoot us a message, and someone will be there to answer your questions. And those are every Tuesday at 8 a.m. and every Thursday at 2 p.m. And you can find the links to those live chats and our webinars in our newsletter. That goes out every Friday. It's called the Last Minute Lowdown. And if you don't think you're on the list to get that newsletter, you can drop your email in the Zoom chat and we will put you on that list. And now I would look to see if we have any questions. Let's see. Okay, Deb, are you ready for a question?
Sure.
All right. Can we give the Department of Health surveyors a copy of our NHSN reporting tool in place of the COVID-19 staff vaccination matrix?
That is a really great question. And as someone who was recently in the facilities, like myself, I'm sure the answer is not one that most are going to like, because you can absolutely give them your NHSN tracking that you're using, as long as every question that was on the DOH vaccination matrix is also incorporated into your NHSN tracking tool that you're using. And I know for some that becomes very cumbersome, because while there are some questions that are the same, there are some questions on that vaccine matrix that are more unique to that are not required for the NHSN reporting.
You know what? I think we have a link regarding that too, and we're going to drop that in the chat right now. And thanks to everyone who dropped in your emails. I got your emails, and we will make sure you get on that list for the last minute lowdown e-newsletter. And I think that's it for questions today. Let me check one more time, the Q&A box, nothing there. All right. So if you would like to reach out to Deborah directly, you can reach her at 1-800-642-8686, and her extension is 7636. And you can also email her at dwright@qualityinsights.org. That's DWRIGHT@qualityinsights.org. And you can check out our other interviews by visiting qualityinsights.org/QIN_vlogs and pods. That's qualityinsights.org/QIN_VLOGS and PODS. And Deborah, thank you for joining us.
Sure. Thank you for having me.
Yeah, and thank all of you for joining us.